gonna do like two, what do I wanna do? I'm gonna do bedpan and bathing.
You are live?
Okay, everyone, we're back. We just had a little tech issue, but you know how it is over here. Make sure you like and subscribe. Put that little notification bell. So I am doing lives more as part of my thing. Follow, share, follow me on all these things, all the apps. Just find me, follow me, all right? So the live part is newer to me. I could stand here and teach all day, but just share it. So now I just went over 10 questions. I can't believe it's 1 already. I'm trying to give you everything by 5. So now let's do 2 skills. I'm going to do, people are voting, I'm going to do bedpan and modified bed bath. Let's do that. Those are 2 kind of like maybe tougher skills, okay? So you always start the same way, hand hygiene, and there's the difference between hand hygiene and washing your hands with soap and water, okay? So hand hygiene, I mean the Purell, okay? Now, in Massachusetts, remember this is a review from Massachusetts, the DNS HD headmaster. So Massachusetts bedpan is one of the 4. So I'm gonna review all 4, and I'm gonna try to get through all the skills. My goal is to demo everything today. So what you're gonna do, bedpan is part of the 4, so when it ends, you wash your hands with soap and water. So when I say hand hygiene, I mean Purell, all right? And then when I mean to say wash your hands with soap and water, I'll say hand wash, soap and water. I'll make that distinction for you. So hand hygiene, gather supplies. I'm just gonna go off screen for a second, get my supplies. Okay? And then I'm gonna knock into the room, close the privacy curtain, and I'm gonna do my intro. Hi, my name is Stephanie. I'm your CNA for today. I'm here to put you on the bedpan. Is that okay? Yes, hurry up. What took you so long? Can I see your ID? Okay, so your intro, you need patient, you need hand hygiene, gather supplies, which you need to just memorize the supplies, knock, enter, close the privacy curtain because that's resident rights, and then you need to do your introduction. The patient has a right to know who you are. It's your name, your job title, what you're doing, and then you need to check their identification, okay? So let me say it one more time smooth so you got it. Hand hygiene, gather supplies, knock, into the room, close the curtain. Hi, my name is Stephanie. I'm your CNA for today. I'm here to put you on a bedpan. Can I see your ID? All right, so that's your intro. So you have gloves. You need 3 pairs of gloves. You have a graduate. You have a paper towel. This is a soapy washcloth. So on the outside of the room, you're gonna wet this and put soap. You have toilet paper. You have a disposable mattress pad. And I brought both bedpans so you could see. I'm gonna put the regular bedpan. If you do, this C or U is pointing up. And then if you put a fractured bedpan, this flat part is pointing up. So I just wanna show you. So I'm going to raise the bed for proper body mechanics. The remote's usually on this other side, but for shooting purposes, we have it here. So it's just a little awkward. I'm raising the bed. How you doing, my friend? I'm gonna lie the head of the bed flat because I'm gonna turn them, so it's easier to turn them with the bed lying flat. Let me let this bed go. I'm gonna do 2 demonstrations and then I'm gonna go back and do more questions, all right? I'm gonna put the side wheel down, and now this is my first pair of gloves, okay? All right, so how you turn, is this table in the way, Theo, or are we good?
We're good.
Okay. How do you turn a patient? Here are my gloves, my first pair of gloves. You turn a patient, ankle, knee. Now watch the technique. A mannequin's obviously gonna turn a little awkwardly. Ankle, knee, you lift up, and then knee, shoulder, and you give a countdown on the count of 3. On the count of 3, I'm gonna turn you. 1, 2, 3, okay? Ooh, my patient's little leg there is amputated. And you know what? My students, I didn't lock the bed at the beginning. So good, that'll teach you out in YouTube world. So the bedpan, again, this C and U is pointing up. I'm gonna put it here. And if it was a real person, it would be better. I'm gonna shoulder and knee. And actually, I think this little leg's amputated. It's okay. They're on the bedpan. And now I take my gloves off correctly. Oh, you know what? I forgot one thing, YouTube land. Ankle and knee, knee and shoulder, turn. Before I put the, we have an amputated foot. It's okay. Before I put the bedpan, we have a disposable mattress pad. This is the permanent mattress pad. This is the disposable with white facing up. I'm gonna lay down because I want to protect it. Now I'm gonna put the bedpan, put it right under the buttocks. Okay, and so now I lie them on it. So now I'm gonna take my gloves off. Remember, I'm not gonna waste all the gloves. It's 3 pairs. I'm showing you now, but then I'll just tell you. Remember, you grab it at the center, pull it, 2 fingers, and it would go in the trash. Side rail up, all right? Now, people keep leaving the bed high and the side rails down. I tell students this, just make pretend it's your grandmother, even if you never stepped a day in school. If you paid someone to take care of your grandmother, hopefully you love your granny, if you paid someone to take care of your grandmother and you came and found the bed high and the side rail down, would you be happy or mad? You understand? You would be upset. So that's it. Do not make CNA more complicated than it is. When you use the bathroom, how do you sit? You don't go lying flat, right? So I'm gonna put the head of bed all the way up. Again, it's a mannequin, so it's sliding, but I'm putting it up. So in the toilet, especially women, but men, if you're handling your business, you sit down on the bathroom. So there should be no confusion about this. Do not make it more complicated than it is. My poor mannequins have been through a lot, so they're slipping and sliding here. Put this here. The toilet paper has to be within reach, and then you're gonna give the call light. Here, dear, I'm gonna give you some privacy. Call me if you need me, okay? When you go to the restroom, is someone there standing watching you? No. So you step out, you step behind the curtain, you give them some privacy. You never let somebody stay on the bedpan for more than 5 minutes. So hand hygiene, knock, knock, come in, close the curtain. Hi, are you done? Yes, I'm all set. Take me off, this thing is super uncomfortable. Okay, so now I'm going to move this again, move it out of the way. And I'm gonna raise the bed. I have to raise it to my body mechanics, to my height. So when you raise the bed, proper body mechanics, it comes to your waist, okay? All right? So now I'm gonna raise it to my waist, okay? So it's going up, 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 and then I'm putting the head of bed down. Okay, side rails down, and now I'm gonna put my second pair of gloves because I want you to watch this part of the video and see if I contaminate anything. If you put the gloves on when I say, you won't contaminate anything at all, okay? So I don't wanna waste the gloves here. Let me just get some more gloves. Let me just demonstrate it and show you. So now I put on the second pair of gloves. Second pair of gloves, and now I'm going to turn them. Now to turn them, think about this. There's urine or diarrhea on the bedpan. If I turn and the bedpan turns like this, it's going to spill. So I have to hold it with one hand. So now I'm going to ankle and knee. During our next little intermission, I'll get a mannequin whose leg's not amputated. So ankle and knee. Now one hand with the shoulder, I hold the bedpan. Let me look and hold the bedpan. Let me actually move this leg here. We're gonna improvise. I hold the bedpan. I hold the shoulder. On the count of 3, I'm gonna turn you. 1, 2, 3. I turn, and so now I pick up and I have it gathered and collected like this, and I can set it right on the floor. Now, you're gonna take toilet paper. You're obviously gonna take as enough as the amount you need to do the job. All 4 of the skills, when you go to the state exam for the skills component, you're either gonna get bedpan, catheter care, emptying a drainage bag, or perineal care, okay? So when you get those things, all of them are embedded soap and water hand wash, and your first skill at the state exam is gonna be one of those 4. I will open the handbook there to show you. So here's the toilet paper. I'm going to go bottom up. A woman, you clean bottom up, bottom up. Okay? All right, and put it on the side of the blue chucks. Don't put it in the bedpan. Now I do shoulder and knee. Don't mind my mannequin's legs. Please ignore that. I do shoulder and knee. I lie them onto their back. And a woman in the front, you're gonna clean top to bottom. The state is making bedpan, catheter care, perineal care on a female patient. I'm gonna clean top to bottom or front to back, okay? So I put it on the side here. I close this, give some modesty. Give this soapy washcloth, have them clean their hands. Can you clean your hands for me, miss? Okay, she's cleaned her hands, both of her hands. All right, I put that in the hamper. Now I'm taking off my third pair of gloves, okay? Now we could either walk to the bathroom or the examiner could put urine in your graduate for you. Let's bring the patient to finishing up steps. Side rails up for safety, all right? Do you wanna sit your head of bed up, miss? Yes, please. All right, so you're gonna make her comfortable. Bed low and locked. So how does a skill finish? Side rails up, patient comfort, bed low and locked, call light within reach, privacy curtain open. You do something with supplies and you document if you have to, okay? So I'm gonna lock my bed. I'm gonna go around and lock it. Call me if you need me, okay? I'm gonna come back around. And so now the examiner is gonna put urine in my graduate here, okay? You would go to the bathroom, but I'm gonna do it right here. The examiner, this isn't me, this is the examiner putting fake urine in the bedpan, okay? So now you would never touch urine with your bare hands. You would go to the bathroom. The examiner might ask you to do it right here on the table, but you would walk to the bathroom. But to stay on camera, I'm going to do it right here. Now, you would never touch that urine with your bare hands. You're gonna get on your third pair of gloves. Your patient's all set. Remember, you're done with them. Here's my third pair of gloves. And so if you want to stop by, Theophil stepped away because people are coming into the school. We're here 793 Crescent Street in Brockton, Healthcare-Edu. We're open Monday through Friday. You could stop by, see any one of us, Cassandra, Jason, Theophil. You could stop by and enroll, or you can enroll on the website, which you see scrolling down on the bottom of your screen. Classes enroll daily, and you could pick your labs, okay? So now I'm going to pick this up. I put the paper towel down because it has to be a barrier. I'm gonna pour the urine. You're never going to get all the urine out of this blue one. The pink bedpan, which I'll get and bring on screen at some point, you'll be able to get all of it out. So now this would go in the trash, right? I don't have a trash can. All of this would go in the trash. You do not lift up the graduate. I did another live going over all of the bold steps where I went in depth on how to measure urine. So you could check out that live. You drop down eye level. So I'm gonna drop down eye level and I'm gonna look to see I have exactly 150 milliliters, okay? I will bring it up to you, try to hold it up to the camera to see there, 150 milliliters. I will clean this bedpan. How you clean the bedpan, the toilet has a hose. Hold the bedpan away from you, get the hose, turn your face and spray lightly. You don't want that splashing you. I would dump the urine, clean the graduate. I will take off, all of this would be trash. I'm going to take off my gloves. All of this would be trash. Let me talk you through it, okay? Take off your glove, grab it there, 2 fingers. Trash, all of this. Now I'm going to wash my hands because I'm done with urine. Remember, I dumped the urine, I measured it, I dumped this, I cleaned this. So there's no contamination, there's no bodily fluid. I'm going to wash my hands with soap and water. That is a bold step for bedpan. Wash my hand washing video where I show you how to, but I could do it, make pretend we have water. You rinse it with hot water, add soap, you get the palms. And again, because I'm staying on camera, you get the back of the hands, you get the wrist, every finger going down one at a time, every finger. You do your nails, you rinse, you take a paper towel, dry, 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 throw in the trash, take one paper towel, don't let your hand contaminate, use that one hand, turn off the faucet, turn off the paper towel. You can watch my hand washing video. It's in the lives, it's all over here. And now I'm gonna go document. I have to go to the documentation sheet and write 150 milliliters, ml. I never document in ounces, always in milliliters, and then the skill is done. So remember, you can get bedpan as the first skill. The bold steps are to wash your hands for at least 20 seconds. Do not contaminate. Watch my hand washing video, or I did another live with the bold steps. And you have to be within 25 mLs of the nurse's measurement, okay? So I don't know if I'm here, if you could see it, but this, every line is 10. 150, 160, 170, you're going up. But I did a drawing and I did a lot of videos talking about how to measure urine, okay? So that's bedpan. You could drop in if you have any questions here. Let me get this off the screen and I'm going to demo modified bed bath, and then we're gonna go back to our questions, okay? All right, let me just take care of this here. So remember I showed you the fractured pan. If you put the fractured pan, you look at the patient, the flat part is up, okay? All right, so let me get this out of the way. Okay, so let's start with modified bed bath. I have hand hygiene. I've gathered my supplies. I'm going to knock, knock, enter. Hi, my name is Stephanie. I'm your CNA for today. I'm here to do a modified bed bath. Is that okay? Can I see your ID? So now this is the first skill I'm showing you for today, where I'm making a clean surface. Now, exam, you could either wipe the table down with Lysol or actually do a clean surface, okay? So I'm going to do a clean surface here. Now, again, tap on my links, all my links to all of my things. I showed you the Healthcare ESL class is groundbreaking. I'm super excited about it. I'm gonna show you the books again. And I'm gonna do a Healthcare ESL class live on Zoom every Thursday, 4 to 6, starting Thursday, January 8th, so you have a little bit of time to sign up. You have to be live on camera mic. We're gonna help you speak it and speak for healthcare to work as a CNA. So I have a basin, soap, I got a gown, towel, bath towel, hand towel, 3 washcloths. Write the supplies down as you see me use them, okay? I'm going to go get some water. I'll be right back. Do-do-do-do. I get some water. I test the water. You have a step that says you have to be comfortably warm. I put my hand in the water. It doesn't feel too hot. Can you check this, miss, and let me know if it's too hot or too cold? You put your hand in it? Okay, thank you. Does it feel good? All right, perfect. I set it down, and now I'm gonna raise my bed for body mechanics. All right, so how's y'all Friday going? Drop in, let me know how you're doing. You know Healthcare-Edu, we're open. We love when you stop by, see us. You could go on the website, the information's scrolling down on the bottom, or you could come by 793 Crescent Street and see us Monday through Friday, all right? So I hope this live, share this live with people that are trying to pass the CNA exam or people that are in CNA school to help them out, okay? Now, I have a whole bunch of stuff down on the bottom. If you want to enroll, there are plenty of classes. If you're already in another school, I have a Pass the CNA Exam product, and we're going from there. But we also offer the MAP, the Medication Administration Program, phlebotomy, HHA courses, and we have clinical medical assistants as well. Okay, so now I'm going to put my side rails down and I'm gonna put my gloves on. I'm not gonna put my gloves on for all the videos. I already showed you how to put gloves on. So just pretend my gloves are on. So notice I touch all objects first, put my gloves on, and I'm about to deal with the patient, okay? So now what you're gonna do, this is a bath blanket. You don't shake All right, you don't let it fall on the floor. You put it on the patient and you keep unfolding. So let me keep unfolding. I'm happy you all decided to spend your Friday with me or whenever you're seeing this. I had tons of turkey. I'm exhausted, but I wanted to just do this all for you all. People who are registered for the state exam, I want you to just go past this month of December and this year right. With the certificate in your hand. There's no need to keep going to the state exam again and again, okay? So hopefully that's what I'm gonna help you see right now, okay? So I've covered the patient. Now for modesty, I have to take the gown out from underneath. You have 2 hands, guys. Don't make it more complicated. Hold this blanket and just pass underneath. Let me see, my poor mannequin's falling apart. Our joints, we gotta screw them. So I'm going to keep passing underneath because I don't want to expose the patient. Oopsie. Hold by the wrist, pass it underneath. Bring it out towards you. I'm holding the gown. It's caught on something. And you know what a human body feels like, you know what I mean? So you could feel underneath. Now, part of infection control, I don't let the gown touch my body, right? Because this patient's bedridden. They're not the one bringing germs across the hospital, it's us. So when I get it, I roll. The proper way is to roll away from you in the hamper, and now we're good. The patient's naked, ready for me to clean. Now, what I'm gonna do, you can bathe the patient totally flat, but I'm going to, normally I wouldn't touch this remote. I'm going to raise the head a pinch because I want you to see on camera. I'm about to do the bold steps and I want you to see. The bold step for modified bed bath is how you clean the eye. Now don't do that to your patient, okay? I'm just fixing the mannequin for you all right there. So, washcloth number 1, water, no soap. You're going to clean inner corner, outer, flip the towel, inner corner, outer. So water, no soap, washcloth number 1, and I'm cleaning inner corner, outer. Get a different spot of the washcloth, inner corner, outer. That is my bold step. Remember, you need an 80% to pass the exam, or you need to get all bold steps on top of it. So if I did everything right, but the one thing I forgot was that eye that I just showed you, you will fail the exam because you missed the bold step. So one more time, and in real life, we wouldn't put it back in the water. I'm just showing you. So I just put the bath blanket on. I took the gown out from underneath. I take washcloth number 1, water, no soap. I have a spot of the washcloth, inner corner, outer, and another spot of the washcloth, inner corner, outer. That is in the hamper. That's my bold step. Now, washcloth number 2, water, no soap. I'm gonna clean the face. Just clean, all right, I'm just cleaning your face, dear. And now I put this on the side of the basin, okay? All right, and so now the hand towel would have been on the chest, but it could go right like so. The hand towel, I will dry the face. So the hand towel I could have put on the chest before I even cleaned the eyes, but it's okay. I dry the face, now I remove the hand towel. Okay, so now I'm gonna expose one arm. It's modified, so they're not doing a full bed bath. Expose one arm. I take the full bath towel, lift it up, oops, right underneath, and now washcloth number 3. That's it. There's no reason to keep going to the state exam again. Water and soap, and now I'm going to clean. Under the arm, C. So basically, an underarm C. This is my soapy washcloth, and now this is my rinse washcloth. You hold it under. Okay, now I'm going to pick it up. I'm going to soak the patient's hand. Soak the hand, soapy washcloth. Soapy, I'm now done with it. Rinse washcloth. Rinse, I'm now done with it. Put it here, and now I can dry. I dry, I take the towel, roll away from me. The towel's rolled away from me. All right, and now I'm gonna put the new gown on. Open this gown up, put it on top of the blanket, like you see here, on top of the blanket. I would hold the patient by the wrist. Hold the patient by the wrist, and now I would tie behind, but now again you have two hands. Hold the gown with one hand. You see, I'm just holding the gown with one hand, and I'm removing the blanket. Roll away from you so it doesn't touch your body. All right, gloves off, side rails, all right? And now I'm gonna go into my finishing up steps. What's the finishing up steps again? Bed low and locked, call light within reach, patient comfort, side rails up. So my side rails up, I'm lowering the bed. Are you comfortable? You want me to stop right there? Okay, let me just lower the bed. I wanna make sure that it's locked. I'm gonna go back to questions right now. Here's your call light. Call me if you need me. And then, therefore, just let me know when the commercial's ready for the books and stuff.
I just have it on a PowerPoint slide.
Yeah, that's it. No, but yeah, the commercial you did, right?
Yeah.
Yes. All right, I'm going to clean up my stuff. It's going to go like so. This, I go to the bathroom, dump it, clean it. This goes away, and I'm all done. So that was 2 skills. Let us go back to questions right now, okay? So let me get this out of the way, guys. All right, so let's go. Let's see if we could cover the whole CNA exam here. Today on this Friday afternoon, we did a live part 1. We shared it, and then we had to stop for intermission. And so this is part 2. So definitely watch part 1 for questions 1 through 10. And now this is part 2. So let me set up and get the vibe board. Should we show the video and then go to questions?
If you could find it, because I saved it to OneDrive, I think.
Okay.
Because like I have it here, but I don't know if it made it over there.
We're gonna come back YouTube world as question number 10. But I'm gonna end the show for now. We're on question number 10. What's it called?
Haitian Creole Book Showcase. Type book showcase first.
It's on the OneDrive?
Yep.
With contact? If you went to PowerPoint, that's where it would be.
Yeah, I just opened PowerPoint. I didn't sign into anything, so.
If you hit save on the top.
I did.
And see, okay. And if not, we'll find it. So if you hit save on the top where the CNA exam questions is, the book, I don't see anything starting with B. Hit save right at the top.
Stephanie Victoria's OneDrive. It's there, I just checked.
All right, we'll go back to it. Let's do question 10. The OneDrive is the contact, not the S Victoria. All right, maybe it needs a second. Just hit save. I'll go back and do some questions, and we'll go back and find it. All right, guys, we were on question number 10. Let's continue on with some multiple choice questions, all right? We're going till 5 here, so we've got 3.5 hours. We're going to keep going. Let's see what we can do. All right, before we do, we did 10. We're on question 11. All right, so we did age, and am I good?
Yeah.
Do I need to adjust anything? Okay, we did age and restoration, which was 2 questions. We did basic nursing skill, which was 8 questions. I'm trying to keep myself together. Let's keep going. Care impaired. You see how when you think it through, how the answers, the CNA exam is really, it tries to trick you, but it doesn't get too complicated. Think it through in your mind, okay? So 3 questions. Let's go. I almost tripped over this whiteboard. A resident with Parkinson's disease may require. Use this moment to think of an answer. Sometimes, and I'm not describing it as formally as I should, but I'm just describing it a way a student might remember in their mind. Sometimes the patient might get a little shaky. It might be difficult for them to do their own ADLs, activities of daily living. It depends on how far along it is, okay? A resident with Parkinson's disease may require, this is question 11, A, encourage the resident to push through it. B, report changes and adjust. What, am I messing this up? I think I messed this up. Okay, let's read it here. So the question number 11, a resident with Parkinson's disease may require A, quick movements, B, time and patience during ADLs, which is activities of daily living. ADLs mean it's activity of daily living. I got up, I showered this morning, I brushed my teeth, I put my clothes on, I fed myself, I'm drinking my shake now. So these are activities of daily living and that I'm able to do on my own. C, forced independence. D, no assistive devices. So the correct answer is B there. So let's go through the steps. So step number 1, to recap, you would read a question, you would let your brain formulate an answer because you don't want to be deceived. Okay? You don't want to be deceived at all. So let your brain formulate an answer, whatever it may be. Force yourself to think about it before looking at the options, okay? Then you think of an answer in your mind. So now when you see the options, so how do you force your brain to look at the answer? Of course, here on the slide, I'm creating that because I don't have the options here. But remember what I told you in the live part 1. And if you're coming to this part 2, there was a part 1 when we did the first 10 questions. You'll find it. You would have an index card and you would flip it front to back with no writing, and most exams, so you would hold it up to the screen and cover the options, okay? So then what you're gonna say is do the confusion to conclusion methodology, okay? Let me get this here. All right, so time and patience with ADLs, okay? That's the correct answer. So now remember the correct answer, the question and the correct answer is a complete thought. A resident with Parkinson's disease may require time and patience during ADLs. Period. It turns it from the question mark to a period. So if that's the case, that means you could put this in front. Time and patience during ADL is what a resident with Parkinson's disease requires. Does that make sense? And it turns it and it makes it a period. Now, the third step of this method, before I say B and move on, which if I did, I would get it correct because it's the correct answer, but you're not sure, right? We're not all child prodigies or geniuses. I'm sure you didn't get 100 on every single exam you ever took. I need to, instead of saying why I think B is correct, I need to say why A, C, and D is incorrect, okay? Quick movements is wrong because they need time, okay? Forced independence, if either a person could do it or can't do it. If they need assistance, that's why you're there. No assistive devices. They might not need an assistive device, but they need your help. So this is my rationale for why I would eliminate A, C, and D. And then now I can be confident that I have the right answer, and then I can move on. So let's go to question number 12. Okay, a visually impaired resident benefits most from, if you're visually impaired, you're blind or partial blindness, what do you think the answer is? I would say maybe speak loudly or guide them. Like if somebody was blind walking through this school, I would say left, right, 2 steps. Like I would speak loud and I would give them direction. It's kind of what I would do. So let's see what's going on here. Rearranging their room weekly. Approaching quietly, announcing yourself and explaining steps, and turning off all lights, okay? So again, remember when I said they have both best? Remember these descriptions, best, you had first, you had priority. So this says most. So which one of these is better for you to do? I would pick answer C, announcing yourself and explaining steps. And this goes along the reason you take a moment when you see a question and come up with the answer in your brain, because now when you see it, you're like, oh, this matches what I was saying. If you read this question and you said to yourself, I don't know, I would cook the food and make it hot. I'm just making something up. When you look here and there's nothing even close to that, you have to reread the question because you're like, something's wrong. And I'm gonna do confusion to conclusion after we do some of these questions. And I'm gonna show you how I explain it with my options, okay? So that's C. The answer to that is C. All right. Actually, before I get to this next question, I think I really want to break down the confusion to conclusion model, and then I come back to here. I'm going to go on a canvas and break it down so that we can continue with the questions so you could understand more of what's going on. Let me end the show. We're on question 13. I definitely will come back. We'll keep doing questions, no worries. I realized that in the beginning, I really wanted to explain the 3-step process a little better. So I'm going to take my time, and Theophil could tell me with the pen if this shows up. So what is your professor's name, okay? Is this showing good? Yeah. Option A, SV. Option B, Steph. Option C, Stephanie Victoria. Option D, let's just say Fafan. Okay, so the first step in confusion to conclusion method is that what is your professor's name? You want to make sure you don't see any of these options and you want to think about something. So say you said Jennifer. Say you said if my name was Jennifer Smith, okay? Now, when you move your index card, you look at the options. If you don't see a Jennifer Smith or anything remotely close to what you thought, immediately cover the options and reread the question. You understand what I mean? Because you think you're reading the question, but the question is also speaking to you. There is deception in a multiple choice question. If I wrote an exam and everyone got 100, I know all the students would be happy, but that wouldn't make my exam worth anything. It would be that it's too easy. If I wrote an exam and everyone failed, you would say to me as a teacher, instructor, what is going on? So I'm trying to get the average. So I'm deceiving you on purpose. I say it's like a date, right? You go, the person looks good, smells good, he or she, whatever you're into, looks good, smells good, but they're deceiving you, all right? We've all been on a date with the wrong person, okay? So now, when I say that is Jennifer and I look and there's no Jennifer here, I immediately could say I need to reread the question because there's something that I missed in that question. Does that make sense? So that right there is going to take you from a 70 to an 80, rereading the question, okay? The next step I'm going to do when I say that it's C, for example, which it is here, I now put the correct option. Stephanie Victoria is your professor's name. Period. It turns it from a question mark to a period. Does that make sense? Turns it from a question mark to a period. Stephanie Victoria is your professor's name, okay? So that fits that. If I said SV is your professor's name, you would say, what does SV stand for? It leads to more questions. Steph is your professor's name. What does Steph stand for? Fafan is your professor's name, so Stephanie Victoria is your professor's name. Then you're going to give yourself a rationale of why you're eliminating A, B, and D. If you say that C is correct, you are thereby saying A, B, and D are incorrect. Does that make sense? So you have to say SV is wrong because it's just initials. SV, does it stand for Stephen Vargas or what? Steph is wrong because it's just a nickname. Fafan's wrong because it's not a first and last, and it's just a nickname. So now I've given myself the rationale. If you are about to make a mistake, say you pick D, but the answer is D. Say you pick D, but the answer is C. If you're about to make a mistake, it's going to be hard for you to tell yourself why you're eliminating C. So I always tell my students, I'll give you $1 million if you tell me why you're eliminating C, okay? If you tell me why you're eliminating C, and you probably can't come up with a sentence. If you can't come up with a sentence, that is a big clue that you're about to eliminate the correct answer. So these are the 3 steps that I want you to use with the multiple choice questions. 1, answer it on your own. Answer it by yourself. Don't look at the options. So that's when you cover it with the index card. 2, do the confusion to conclusion. Put what you believe to be the right answer in front of the question. And 3, rationale for why you're eliminating the other 3 options. Okay, so that's your 3-step here. So let's go back to the PowerPoint because I wanted to kind of just go over that with a regular question. And let's come back to slide 13. Let's do another 20 and then we will do a multiple choice, okay? When assisting a resident with dementia who becomes agitated, what is the best thing? Raise your voice. I shouldn't have added words. They put a semicolon, they didn't put a question. When assisting a resident with dementia who becomes agitated, and then they left it here. It's for you to finish the sentence. Raise your voice, redirect with a calm, reassuring tone, argue firmly, leave them alone indefinitely. All right, so what do you believe is the correct answer? So when you got it here, you would have thought for a moment, if someone has dementia and they're agitated, I'm thinking I'm gonna try to calm them down, right? That's what I would have said in my mind. Now when I come, you see option B, redirect with a calm, reassuring tone. Okay, so now what I'm going to do, option B, redirect with a calm, reassuring tone. Let me get my pen here. All right, I'm gonna say redirect with a calm, reassuring tone is what you do when you're assisting a resident with dementia who becomes agitated, period, okay? And then why am I eliminating? Would you raise your voice? This is rude. Would you raise your voice on somebody with dementia? It could actually be considered verbally abusive. Would you argue firmly? You don't argue with a patient. Don't argue with patient. Leave them alone indefinitely. This sounds crazy. Leave them alone forever. Basically, you don't want to work with dementia patients. All right? Dale's laughing at the options here. So we're going to teach you here. All right? So the correct answer is B. All right, guys, let's keep going. And we're gonna try to find, so just make sure that the commercial's on contact.
It says that it's up on the computer.
We'll refresh it. I wanna show you a commercial. We'll go back and we do 2 more. If you leave in the chat, guys, you can let me know what other skill you want to see. Maybe I'll do perineal care up next because I wanna make sure I do the 4 today. Maybe I'll do perineal care. So we did bedpan and we also did, modified bed bath. So that was care impaired, okay? So the care impaired questions, you have a dementia, you have a, let's go to number 12. You have a visually impaired, and you have Parkinson's. So these are examples of care impaired, meaning that there's something that's going on with the patient that's gonna make it a little bit more difficult for you to care for them, okay? Now, communications, they have 5 questions. There's verbal communication, nonverbal, there's communication with your mouth, but don't forget when you document, you're communicating as well, okay? Now, remember what I told you for the beginning, these are the questions that I'm picking, but we don't know what questions you're going to get. If you need me to elaborate mini lectures on any of these, let me know the concept of communication and we'll go over it. So let's go over 5. What is an example of active listening? All right, I always say, listen, you know with your partner, boyfriend, girlfriend, husband, wife, whatever the situation is, you know when they're not listening to you, right? How do you know? Because they're looking away, they seem distant. So what does active listening mean? So don't freak out. Sometimes if you didn't study the concept, don't freak out. And can you tell if I'm listening? I know I'm a teacher, how I can tell you're looking at me, you're not looking through me, you're making eye contact, it looks like you're attentive, okay? Which is an example of active listening. So I'm gonna say someone looking at me attentively is an example. So now here are the options: interrupting, facing the resident and maintaining eye contact, finishing their sentence, looking away. So the answer is option B. Hopefully you picked that one. Hopefully what you said in your mind is similar to that. And so now let's put it ahead. Facing the resident and maintaining eye contact is an example of active listening. It changes it from a question mark to a period. That's a period, right? It doesn't ask you for any more options or anything. Now, interrupting is an example of active listening. It doesn't even sound right. See, that's why I like this step, because you do the sound test. Finishing their sentences is an example of active listening. No. Looking away is an example of active listening. No. Okay? And now you're going to provide rationale. Interrupting is not listening, right? Finishing their sentences is not polite, actually. All right, looking away is definitely not, you're not attentive. So these are my rationales. So I've implemented the 3 steps and I come up with option B, and now I move on, okay? All right, guys, let's plug away. I want to do some more skills. I want to show you about the book. We already went through this, so this is why, and we're gonna come up with a book that you could do all of this on your own. If you would like that, to have the questions where you could fill in the answer and then walk through the steps the way I'm doing it. If it's something you think you'd like, definitely leave that in the comment and we'll go from there. Question number 15, a resident asked, am I going to die today? The best response, so here you see best again, okay, is probably not. Why would you say that? Tell me more about how you're feeling. Don't think like that. Okay, sometimes these subjective questions, because listen, in truth, like I told you, the bulk of my experiences in oncology, I did hospice, death, and dying. These are real. A lot of times the CNA and the nurse are the last people, like we call family members, to head over as soon as we can. I've had patients beg me not to leave the room. I've had patients ask. If patients all of a sudden start saying, I'm gonna die, sometimes that's called, I'm blinking on the medical term, ominous feeling. A lot of things happen. I say everyone is born and then everyone passes away. That's what we all have in common. So a lot of CNAs in class, when I say postmortem care, a lot of my students, they say, what, we'll be doing that? And I say, yeah, because you're with that patient. You're with that patient till the end. So you do have a lot of people ask these questions, okay? So what is your best response? Tell me more about how you're feeling. That's best. Again, because what if they're hospice and they're end of life? You can't ever answer anything like probably not. You can't say, and you might be tempted to say something, don't think like that, but it might be insensitive. What if the patient is literally stage 4 terminal cancer? You can't like give this false hope. It's way outside of your scope. So this one is a trick, because everybody would want to say, don't think like that. But the patient might actually get enraged because they might actually be looking at end of life. Some people know, so they're planning their affairs and all of that, okay, in the case of cancer. And then why would you say that? So C is the best, okay? C is the best. You might have thought B. Why would you say that? To let them, basically the point, you're letting them speak and air out their feelings. But again, if they have a diagnosis, they're going to look at you like you're stupid. Like, why are you saying, why would I say that? C just allows them to speak. Tell me more about how you're feeling. Do you see the difference? So that's why C is better than B. Does that make sense? Okay. So that's 15. 16, which communication technique promotes dignity? You want to promote dignity. So what's the word dignity? Like respect, make the patient feel comfortable. So I would say, if I had to think about it before I went off and looked at the options, I would say as long as I was polite, I called them by their name. Okay? So now, calling the resident honey. You may not feel anything about it, but the person may not have that comfort level with you for you to say that. Using the resident's preferred name. So somebody, my name is Stephanie. I actually hate Steffi, like hate it, okay? I hate Steph. So I'm just not gonna be comfortable. So you would say, and I would say, oh, just call me Stephanie. So then that is the name that you would move using forward. You're not going to say because you like the nickname Stephanie that you keep calling me, because you like the nickname Steffi, you keep calling me Steffi. Jeez, it doesn't make sense. Talking over them or ignoring the questions. So promotes dignity is this one, using the resident's preferred name. So that's what I said. Using the resident's preferred name is the communication technique that promotes dignity. You see that changes that from a question mark to a period. You're done, okay? This one, ignoring the questions, that's rude. So that's why you're eliminating that. Talking over them is rude. That's why you're eliminating that. Calling the resident honey, you may not intend it to be rude, but they can take it as being rude, okay? Even though that's not your intention, all right? So B is the correct answer. Using the resident's preferred name. All right, let's keep it going. All right, a resident who speaks little English needs directions. The CNA should. If I'm talking to you out in YouTube land, and hopefully you put YouTube in your preferred language because it'll auto dub the language. But if I'm speaking to someone and they speak Russian, I don't speak Russian. What do you think? That's why when I say don't make the questions more complicated, I'm going to be more demonstrative with my hand and my body. Like if I don't know how they say cup, I'm gonna point to this. I'm gonna say turn. I'm gonna gesture more, all right? Because the person does not speak my language, all right? That's what the answer I come up with in my brain. So now speak louder. Why does that matter? They don't understand you. Use simple words and gestures. Avoid eye contact, ignore language barriers. The answer is B, okay? Use simple words and gestures with a resident who speaks little English and needs direction. The key is that they need direction. So if I need you to stop, I'm gonna say, wait, go, walk faster. I'm gonna do something and I'm gonna gesture, okay? All right, so that's 17. We're in communication. So we gave you a lot of different variety of types of communication. Documentation. Remember, documenting is communication as well. Documentation must be. I would say documentation, you can't erase it. It has to be able to be read. It has to be accurate. So even without looking at the options, I would say your documentation must be legible. They can read it. Or if you're using a computer system, it has to be accurate. So I'm going to say documentation must be legible and accurate. That's what I'm going to come up with my brain first. And then I'm going to slide and look at the answer. Documentation must be vague. That doesn't sound right. Opinion-based. You want somebody putting their own opinion in your medical charts. Accurate and accurate, done only if convenient. So the correct answer is C. Objective and accurate is what documentation must be, period, okay? Not vague, not opinion-based, and not done only if convenient. So you put the correct option in front of the question. Is it conclusive? Yes. Remember, the correct answer and the question is a complete thought. All right, so that's what we're working through here. Then provide the rationale for why you're eliminating the other three options. I'm eliminating vague because that doesn't make sense. Why would I write down something that's vague? Vague means that you don't have clarity. In case you don't know what vague means. Like you're going to say, I'm wearing something that could be considered clothing, instead of saying that I'm wearing a pink shirt. You understand? Document, you're going to document what is accurate and objective. Now let's talk about objective. Objective means measurable. A blood pressure is measurable. So it's subjective. A temperature, you don't say kind of, you say the temperature is 98.6 because you read that with the thermometer. Is measurable. They urinated, we just did bedpan on part 1. They urinated 150 milligrams. I looked and I measured. So objective is something that you can measure, in case you don't know that. Subjective is how they feel. If I feel anxious, that is subjective. That's not a measurement. Versus if you take my blood pressure and it's 122/92, that's an objective measurement of my blood pressure. So you might not, a lot of times you fail because you just don't know what the word means, okay? All right, which is why they give you a vocabulary list. All right, let's keep plugging away here. Now, so we did communication. Now let's recap. Communication, you had a documentation question, and your book always go through documentation. You had English as a second language question, which is gonna lead us. The patients sometimes could have trouble with English, and you sometimes. So that's a communication issue. Ooh, sorry. That's a communication issue. You had how to speak to them, promote dignity, which they're always going to ask you. You had, this is a communication question because they want to know that you have interpersonal skills, meaning how to talk to a patient. You're not going to go in the room and just say crazy, wild things. Yes, you're going to die today. Or no, you're not, you stay within your lane of how you're supposed to speak to a patient. So they want to know that. Active listening, I see that question all the time. All right, so those are your 5 types of communication questions that we gave you. But again, notice communication 5 is more than the care impaired, which was only 3, because they want to know that you could communicate with the patient. They're always going to ask you documentation, okay? So just make sure you know that and review your documentation chapters. All right, data collection, 2 questions. You see, I've never, so far, I haven't given you anything that's overly complicated. You just have to take a step back and think about it, which is why I'm showing you the technique. Force your brain to think about it first, then look at the options, see if it matches what was already in your mind. If you need to reread the question, do that. When you pick an option, put it in front of the question to kind of see how it flows. And then before you move on, if you say B is correct, you are thereby saying A, C, and D is incorrect. And you have to rationalize. You have to tell yourself why you're eliminating the other options. Those are the 3 that you can implement in 60 seconds, okay? So you could do a multiple choice exam. Okay, data collection, let's go. I want to do some more demonstration. A CNA observes a new area on a resident's heel. The CNA should. What do you think you should do? I mean, I know CNAs observe, record, and report. So I would tell my nurse and I would write it down somewhere, right? I think those are the 2 things, right? And look, right? Ignore it, apply ointment, wait until the next shift, document and report immediately. So it's document and report immediately. Document and report immediately is what a CNA should do when they observe a new area on a resident's heel. Let's talk about reporting. And so I'm happy this question came up. Let me talk about some real life. You're not gonna say stage 1 or stage 2 because you don't assess. You're just going to report what it looks like. Let me be very clear, because a lot of times CNAs forget how litigious their work is. You don't want to be in court. You are not allowed to say this is a stage 1, this is a stage 2. You're allowed to say there's a quarter size red spot on the left heel. The nurse is made aware. You're describing it. You're not saying what it is directly. Does that make sense? I hope that makes sense to you. That's the difference. Don't go around in patients' charts saying that it's stage 1, stage 2, and all of this. Don't do that, okay? Ooh. Lord, if I trip over this vibe board in this live, don't laugh at me here, okay? So why A is correct. So why are you eliminating B? Wait until the next shift. No, why? You're supposed to report what you find on your shift. So that doesn't make sense. C, apply ointment. Are you a doctor? Did you get a prescription? Do you know what it is? How do you make a decision to apply ointment? That's outside of your scope. And ignoring it, are you a good worker if you ignore things on the person's physical body? No, you're not. So that's why you're eliminating B, C, and D, okay? Ooh, something smells good. Theophil's eating while I'm doing this live, y'all. He's torturing me, and I'm trying to drink my cassava. I'm trying to drink my cassava shake. We're going to be real here. I've been standing up here talking, and we talked about weight, and you can see on camera, I don't care. I'm trying to lose some weight here. And Theophil is ordering what? What are you ordering, Theo?
She's got pizza.
He's eating pizza while I'm standing here with the smoothie.
It's in the other room.
But it smells good. To their credit, I can smell it, okay? When documenting intake, which is included, okay? What is included? Let me see. That question's a little confusing. I think maybe I would say, what do I document intake? What they drink, if they get blood, if they get IV fluids. So that's kind of where my mind goes. So let me see. Okay. Intake. So here's the options here. Basically this question wants to know if you know what an intake is and an output. All right, so let's go over that real quick here. Again, this is to review. I got to 20. Let me finish this and I'm gonna do another demonstration, all right? Intake is something that goes in, IV fluids, what you drink, if you get blood, if you get G-tubes, some people are fed through their stomach. Those are all in, okay? Output, your urine. Void means urine. Emesis, remember we had that question, vomit, diarrhea. So intake is liquid in, liquid out. Okay? So the only thing that meets this, not water left in the cup, that means they didn't drink it. So the only thing that meets this is A. IV fluid is included when you document an intake, okay? And then why you eliminate the other one? Smells just has nothing to do with it. Water left in the cup, it didn't go in their body. Food touching their lips is just silliness, okay? It's not an intake. So A is IV fluids. Let me put this down. This is how we're spending our Friday afternoon here with you, all right? Watch this on the replay. Send this link, guys. So it'll be all that you need. Let me see if we're almost done with this section, and then I want to do some. So again, every one of them is going to go over the rationales. I want to do some questions. Let's stop there. That was 7, and I've lost track of what section we just did, but I hope you're keeping track. And so, because the state exam has 60 questions. So we've been breaking it down on what they have. And now disease processes, we're gonna have 7 questions for disease processes. So we are almost there. It's 2:15. I wanna get through all of these 60 questions, and I wanna see if I could demo all of the skills. It's a big, big task. So let's get through it and see. Between part 1 of this live stream, so this is what you're gonna do. When somebody, oh, come on, work with me. When somebody is going to pass the state exam, either yourself, okay. Either yourself or a friend, share this live. I know this is, there we go, end the show. This is so sensitive. We're at disease process. What you're going to do, I made a video of all the bold steps. So you're gonna go to my live tab. You're gonna see a video of all the bold steps. You're gonna see part 1 of these lives. I had already done questions 1 through 10 and 2 skills. And now watch this. Let's see if we could stream this through without completion, okay? So I'm giving you this one place to go. It'll be 3 live videos, and you could just watch it and prepare for the state exam. We are in Massachusetts, the state CNA exam. Yes, I agree with you, Theo. Okay. Let's do this. Let's take a little break, not going anywhere. Let's do a showcase. What am I supposed to do?
If you start the show, it should run. Now, click the...
But the video of the girl.
I don't know where to put that.
You sent it to me.
That's really tough.
This is an example. I don't know how to turn it down. Let me just show you. I'm going to show you the book again. Let's take a little intermission. So we had a girl read, one of our students reading the phrases. So if I try to read it, obviously I speak English. You're not gonna have the authenticity, but we had a student with all the videos. You sent it to a drive and Theophil's gonna get it on here. So obviously I am helping you with passing, but let's talk again. Let's take a little intermission to speak about these books and our healthcare ESL class. I cannot rave about them enough. Listen to me, guys. Do not go and take a class where the person is teaching in your native language. Although you're comfortable, tell me how this is on screen.
Oh, sorry.
It's okay. Although you're comfortable, it's not ideal. Okay, it lines up with the camera. So this is the Haitian one I'm gonna show you on Amazon. So again, let me show you some other pages. This is the table of contents. So it has it, if you're helping someone with the wheelchair, feeding, bathroom, urination, you're gonna turn to that page because this is for you to speak. Let me find a good page, okay? Here, and I'm good on screen. If you promise,
Higher.
higher, okay.
It's like uncomfortably, like, yeah.
Okay, Adele is gonna look at it. You have the phrase in Haitian Creole, the phrase in English, and this is the phonetics. This is how they sound to pronounce it. So there's no book that's giving you both things. Like, what am I saying? Sometimes you have to translate to read, but you're not reading in a patient's room.
Hi, speak healthcare.
Telling you, I want to get up, go use the bathroom, go use the wheelchair. How you can say all of these things? I'm here to use the wheelchair. I'm here to go to the bathroom.
Hello, all of
that.
my CNAs and HHAs.
Phonetically, this is the Haitian book, okay? This is the
Si vous
Spanish book.
parlez anglais
And
médical,
again,
l'autre
I
cours anglais.
also have phrases from when you go. Am I
Hello,
good
this
right
is
here?
the only book.
This is the Spanish book. They'll
I'm going to the...
No, it's okay. Yeah.
Yeah, this is good.
Okay, this is the Spanish book. All right, so now you have the phrase in Spanish. You're in the room with the patient.
Hello.
You need to tell them you need to get them out of bed.
Wait.
You have the phrase in English and you have the phonetics. This is not spelling.
Ok,
Do not
haïtien,
go
vous
and
besoin
say
parler
that it's
anglais
not
avec passion
spelled
comme
correctly.
CNA à
It's
HHA,
phonetically.
mais
And we're gonna
celle
show
vous
you 'cause we
besoin.
have somebody
La
who
baille
actually
phrase là
uses
en
this is
créole et
Spanish.
puis vous
And I'm
prononcer
gonna
les
show you on
phonétiques
YouTube.
pour dire en
This is
anglais.
Portuguese,
Dis
okay?
fois ça en
All right,
créole.
I'm good on the Portuguese. I keep moving. I need a landmark. This is Portuguese.
Okay? En anglais, I'm here
So,
to
the
take your
Portuguese one,
temperature.
here's the phrase, and
Kounya,
this is for my
prononcer lettre
conversion
pour 10 phrases là en
And we
anglais.
did obviously Portuguese, and we
I
did the
am here
Portuguese.
to
Ooh,
take
I know there's a
your
Portuguese from Brazil or from
temperature.
actual Portugal. I want to say the Brazilian
Okay,
one.
good. I am here to
So
take
this
your
is English and
temperature.
then the
Ou ka pran n'importe
So
moun ki
you're,
pa pale
hello, I'm
anglais,
your
y a
nursing
prononse
assistant, and
lettre
I'm
et
here
puis y
to
a
help
dit
you
quelques
to the
phrases
bathroom.
médicales. Liv sa
Hear me
besoin
now.
seulement.
I am telling you, if someone does not speak at all, when they come to school, I can show them demonstratively kinetic with my hands what to do, but now they pair it with speaking. And that's going to buy yourself time or your loved one's time to get a grasp of the full English language. So before we come back to this, I actually want to show you on YouTube and show you a different thing. So listen, guys. And I'm gonna do another talk with you too before I actually do that. We'll have a little mini chat. Oh, end screen. Okay. So let me go back to the Amazon page. What you're going to do, we're on Amazon here. This is it on Amazon. You can just type it. This is what it looks like. It's my book, Haitian Creole to English, and you can purchase it, okay? You can Kindle it or purchase it. A lot of people don't use Kindle, but when they go to work, you can put this. Again, if you know, and I'm not hyping you up, I don't sell just to sell. You know people in a job interview, they go and they can't get the job because they can't speak to the patient. I mean, to the HR person. So they're going to recruit. So a lot of things here. On the back of it, we have vocabulary words as well. And so this is the size of the book. You could see it in hand. If you're in Brockton, you could come by the school. Now, see if this is this good, Dale?
Yes.
Okay, look at
Even go closer.
what is your starting pay? Okay, this is how you're saying, are there benefits? What is the work schedule? So you can go and speak to them. I tried to think of every single phrase you can use, okay? And the vocab. And so again, remember, whatever I'm showing you in one book is the same formatting in all three. You want to open those curtains? Or are you good? No. It's the same formatting in all three, okay? So on Amazon, you're gonna check out our link here. This is Haitian Creole to English Speaking Guide for Entry-Level Healthcare Workers. Then you have Spanish. Here's the Spanish, they're all the same price, right? No discrimination against language. Here's the Spanish to English Speaking Guide for entry-level healthcare workers and Spanish. All right, I already showed you that. And here is the Portuguese, guys. I am very, very proud of this book, and I know that you will love it too. This is exactly what you need, okay? Let me put to English. And then I'm gonna show you something else. And here's the Portuguese one. All on Amazon. You can get them for Prime, November 30th. This is what, and I'm telling you, I buy my children gifts too. I know those kid gifts, but you need something that you could go out into this world and be essential. Options as a lifestyle. Now, another thing that I'm going to show you, I wonder if I can. I want to show you art. Let me just tell you, go down into the description of this video. I have a healthcare ESL class starting live on Zoom. This is not booksy. When you go to I kept trying to figure out what's going on with the students. I started this and people were like, they're in a ESL class. And they are, you guys are. You're going around, you're taking all of these classes. But when they're telling you noun, verb, all of this, but when you go to the patient room and the patient says, help, call my nurse, and you don't understand, I'm having chest pain, get me out of the wheelchair, my colostomy bag, you don't, a traditional ESL class is not going to get you to this, okay? It's not gonna happen. They're not going to get you there. You need a healthcare ESL class to make it work, okay? I'm like, should I draw blood on you? My husband just came. Well, we'll keep it CNA and MAP today, but if you go on phlebotomy, I actually drew blood, so you can see a blood draw live, right? Because we offer phlebotomy tech as well. But let me not digress and stay back on this healthcare ESL. I went to school to teach nursing and CNA. Just put it down. Nursing and CNA and all of that. But then I saw the need for the English, the speaking. This is going to get you working, and then you can learn formally English as you move along. So drop down in the link. All the links to the books on Amazon is there. You will not regret them. And then also the link to the class is going to start every Thursday live, 4 to 6 p.m. And so it's a monthly subscription, cancel anytime. So right now, because we have a little bit till January 8th, you could secure your spots limited. It's gonna be phenomenal. We're gonna break out into rooms. If you're Spanish, you need to have your book in front of you. You guys are gonna practice the words. I even have more books. I'm gonna make you a pro in this CNA HHA. I am an educator. And now I wanna say one thing too. For example, to open a school, you have to be a nurse, right? A CNA school, which I am. Now, you have to ask yourself, is the person an educator? That's why looking with my educator lens is how I was able to come up with these books, because I could see what was needed. So somebody can do hair, and they're a phenomenal hairdresser, like amazing. But then that doesn't mean they could teach you to do hair. So make your decision wisely on what school you want to attend that has all of the benefits so that you could have support, okay? Okay, I think that was our little intermission. Theophil's gonna tell me when we're good to show the little video, and then we're gonna do perineal care. What should I do with perineal care?
I don't know if it updated for you, but I have it saved on my side.
Okay. So before we go, we're gonna do just a little plug while I have y'all here. So Healthcare-Edu, when you go on Google, not now. What is this? all right? And you know how hard it is to get Google reviews? You can look at our Google reviews here. We have people posting that they passed the CNA exam. Oh, let me give her a little heart. They passed the CNA exam. I'm gonna actually do a commercial coming up this week. I'm just gonna read, okay? DNS HD headmaster came to Massachusetts in August of 2022. Since August 2022, and I think I have to check the past few days, we have 395, as of 2 days ago, people who have passed their CNA exam. I want you to put that in perspective one moment on the state of school, all right? Schools do like 10, and there's people who are working who haven't even taken the state exam. But I'm telling you, one school has 395 and counting who have become certified, not graduates. I graduate more than that. So when you go to a school and they're talking about pass rate, and this is what I'm gonna tell you. 60% of $10 is what? $6, right? And, or 50% of $100 is what? $50. Would you prefer $6 or $50? I'm gonna do a commercial and I'm just gonna read off all of the names. I would never get on here and lie and call off people's names. So you need to ask the school how many people they've sent in what time frame to become certified, okay? So that's our number. Compare it with other schools, and you see people here leaving reviews, okay? So that's Healthcare-Edu. So everything I do for y'all, all right? So go ahead, you could read it. They're posting their pass and all of that. So, okay, now what else do I want to show you? Let's get back into it. Let's finish up this language so people can understand, and then we're gonna go back and do some demonstration. I wonder if it's from the beginning. Hold on, I think I have to exit and come back out. 1 second, y'all, stay with me, I'm here. I'm gonna do perineal care next, okay? I only see one slide.
That's what I'm saying. I don't know.
Okay, all right, that's cool. We'll find it. If you just send it, if you send it in the emails on top of the email, I could pull it up because I really want them to see, because she's a real student that was using the book, okay? If you send it to the email and I put it on top, or if there's a way, because I don't want to take the phone off, because I could share it to Vibeboard and play. All right, y'all, let's go back and do some skills. I want to do perineal care. You can stay right there. You don't have to go anywhere. And let's do perineal care and dressing, okay? So I did bedpan. I'm trying to pick the toughest one in case time is not on our side here, but I will make it happen. Okay, I have hand hygiene, I knock, I hand hygiene, I gather my supplies, I knock, I enter, I close the curtain behind me. Hi, my name is Stephanie. I'm your CNA for today. I am here to to do your perineal care. Is that okay? Can I see your ID? Okay, I forgot some paper towels. I'm gonna go get it and be right back. There's nothing wrong with forgetting anything. You don't get fired because you forget anything. I'm going out. Her bed is not raised, so everything is safe. All right, I'm back. So I'm gonna cover the table with paper towels, just like I did in modified bed bath. Okay, I'm gonna get some water and be right back. I go get water. I'm going to take it here. I'm going to put my hand, check it, make sure it's not too hot or too cold. All right, can you check the water, make sure it's comfortable? It feels good, thank you. All right, perfect. All right, so let me move this here so you can see. I'm going to raise my bed. Lie my head down flat. Side rails down. And the bed can actually go up higher. I'm just trying to move quick so we don't have a lot of dead space in the video. All right, I'm gonna put on my gloves. So I have plenty of videos showing you how to put on gloves. I'm gonna put on my gloves, okay? So now I'm going to clean the front. I'm gonna hold the ankle. My poor patient's foot is amputated. Open like this, and then I'm going to go like so. Okay, all right, open like so. And then what I'm going to do, I'm going to take this here, hold underneath, all right? And then I'm going to now take washcloth number 1. You have labia major and labia minor, gives you 4 crease in the vaginal area. And so you gotta clean the vaginal area top to bottom or front to back, okay? So you have 4 sides of the washcloth, 1, 2, 3, 4. So water and soap, all right? I'm gonna take it top to bottom. And if it's not zoomed in, I have videos that are zoomed in top to bottom, turn the washcloth, top to bottom, turn the washcloth, top to bottom, turn the washcloth. That goes in the hamper. That's your soapy. You have rinse, okay? Top to bottom, turn the washcloth, 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 okay? Then you have this, you could pat dry. Okay, so now I'm gonna put this down, close her legs, and I'm gonna call for help, okay? We're not gonna have a person there because I'm by myself. Theophil's off camera, but this is how I turn. I'm gonna say, nurse, can you come help me, please? The nurse will walk over and stand on that side. I'm going to ankle and knee, and then knee and shoulder, all right? And now on the back side here, here's washcloth number 3. It's water and soap. And I'm gonna clean from vagina up. Vagina up is bold. Vagina up, flip the washcloth, vagina up. Hamper, okay? Then I'm going to rinse, okay? Vagina up, flip the washcloth, vagina up. Hamper. This towel was left here, so I'm gonna use it to dry, vagina up, roll away from my body, put it here. I'm gonna roll this out, this goes in the trash. I'm putting the hamper because I don't have trash here, but it goes in the trash. And shoulder and knee, okay? All right, I'm gonna take my gloves off. I'm gonna put the side rail up. I'm gonna go up, I'm gonna lower the bed here. Are you comfortable? So what am I finishing up steps? Side rails up, bed low and locked, call light within reach. There's your call light, call me if you need me. I'm making sure the bed is locked. This, I'm gonna dump the water away. I'm gonna dump the water away. All right, clean that. And now I'm gonna wash my hands with soap and water because perineal care is one of the 4. So we've now done 2 of the 4. We've done bedpan and we've done perineal care, okay? So I'm gonna wash my hands with soap and water and I am done. All right, let's go and do some questions because I also wanna open map a little bit too because this is like a showcase kind of. I'm trying to get you guys through some exams. So I wanna open map. So let's go ahead and do this. All right, let's go ahead. Can I go ahead with my questions? All right, so we did aging and restorative, 2 questions. We did basic nursing skills, 8 questions. I think I got to get a move on these questions. We did care impaired, 3 questions. We did communication, 5 questions. Stop and replay this video. We did data collection, 2 questions. Did I do data collection? Yeah. So we're up to disease process 7 questions, okay? Let me see if I could just get this going from current slide. Question 21. All right. I think maybe I'll go a little more than 10. We'll see. If you have some questions, answer. A resident with COPD may show. Now, you just have to know what COPD is. So we know it's not nursing school. They're going to pick the bigger ones, okay? We're not going to ask you some obscure disease process. That's not what you're studying. So for safeguarding, you should read a little bit about diabetes. You should read a little bit about COPD when they mention in the chapter. I already told you there's always in every CNA book, there's an aging adult section, like what happens to people as they just get older. Alzheimer's, dementia. You saw Parkinson's, because they're going to do what's kind of, and there's always like either they fell or a heart kind of, if they have heart issues, heart failure and stuff like that. All right. So, difficulty breathing, dyspnea, excessive hunger, low oxygen, but no symptoms, not low oxygen, and no coughing, okay? So let's go through it here. The question is difficulty breathing. The answer is A. 21, a resident with COPD may show difficulty breathing, which is called dyspnea, okay? Now, sometimes what's a little bit is that their oxygen saturation can be a little bit lower. So typically myself, if I was to put an oximeter on, I would be 95 to 100%. Their oxygen can be like 88%, and that's their norm, but they might have some other symptoms, okay? So you would put this, you would have come, did I go ahead? Okay. So that's A. Sorry, this is diabetes warning signs. Some signs of diabetes is high blood sugar or low blood sugar. So before we go on here, I want to do this. Hypo before something always means low. Hyper always means high, okay? So if it's hypocardia, it's high heart rate. Hypotachia, I'm like, my blood sugar is going down myself. I might have to give myself a little break. Okay, let's go over here. So now, here's some of the dry signs, some of the warning signs. Dry skin, thirst, and frequent urination. B, purple rash. C, no appetite. D, sudden hearing loss. So diabetes warning sign, it's not giving you any clue in the question. They're just testing your knowledge to see if you understand diabetes. So people with diabetes or diabetics might have dry skin. They might often be thirsty, and they frequently urinate. So the answer is A. So questions like these, like 22 and 21, is oftentimes dangerous because it's not giving you a clue in the question. Like, it's not giving you a scenario to say best or most. If you've never heard of diabetes in your life, if you went through CNA school, but just in general in the public, because a lot of people are diabetic, you would have heard of it. But if you never heard of diabetes in your life, it's a straight knowledge question. Either you know what the term is or you don't, okay? So the answer is there is A. Now, when you provide a rationale, you would have to know what diabetes is to understand that. Is it a purple rash, no appetite, sudden hearing loss, that they have nothing to do with diabetes. But that means that you just have to simply know what diabetes is, okay? All right, hypertension, I'm getting into some kind of knowledge questions. So these are disease processes. So hypertension, this hyper means elevated, and tension is your blood pressure. So this means a high BP. These questions are not difficult. They're in the disease processes. They're just making sure you understand the term, okay? All right. All right, so a resident with heart failure needs. What does a resident with heart failure need? Basically, when we talk about feeding, maybe I'll do feeding as the next skill. When we talk about feeding, we talk about the diet orders. Someone could be on a regular diet, a diabetic diet, a heart healthy diet. And so basically anything pertaining to the heart, salt is their enemy, for lack of a better word. Water follows salt and salt follows water. So if you have heart failure, basically what I would say that you need, here are the things you need. You need weights daily to make sure you're not putting on a lot of fluid. You need a heart healthy diet and to avoid salt as much as possible, okay? And those are the two bigger things that I would say. So this is me, use this moment to think of an answer. And now, here's the options. So number 24, a resident with heart failure needs unlimited fluids. No. What is heart failure? Heart failure, a lot of times they could have excessive, too much fluid, so they wouldn't need unlimited fluids. I told you they have to be careful of their salt. So a high salt diet, because water follows salt. Here's your little salt grains here. I don't want to get into a fluid lecture. So water would follow salt. So the more salt you have, water is going to be drawn to it. So no activity. And now option B, daily weight monitoring. You're doing that because when they get the water build up so much, and this is a very, very simplistic explanation of heart failure, it's almost too much fluid for the machine. The heart is a machine that is pumping, a muscle. It's too much fluid for it to pump and you get it backlogged, okay? So if you think about it, I'm trying to think what circulatory system. You have the heart and the lungs. Too much fluid is gonna backflow, it's gonna build up, okay? And you don't want that. So the reason you weigh them daily, and remember we talked about weight, I gave you an example of the oncology patient. With these questions, don't think about it as like you want to lose weight so you can look good for the summer. That's kind of not the reason for weight. When they're doing daily weights, they're trying to make sure, in the example of the chemotherapy and the heart failure, they're trying to make sure that the fluid is not building up. I drink water, I urinate water, and I'm kind of always equal, okay? If I'm in heart failure, I'm drinking, getting all this fluid, but it's kind of not going, it's building up in my circulatory system. It's the best way to explain it, so that's why B is the correct option, okay? Daily weight monitoring is what a resident with heart failure needs, okay? So let me see. Let's go through these questions. I want to go through a couple of them. I want to see if I could get to 60. If not, I'll do another part because I want to do MAP as well. Okay, stroke symptoms include, all right? Stroke symptoms include, right here, you should think of the FAST acronym. So if you haven't, let us go over the FAST acronym. Here is the acronym if someone is having a stroke. It's called FAST, F-A-S-T. This is face. So when you look at me right now, smile, I smile, it's symmetrical. Let me try to hold it. If I smiled and one side went up and the other stayed down, it would be asymmetrical. So any changes to the symmetry of the face is for the F. A, arms, and it could be legs as well. If I hold my arms up and one starts shaking and going down, I don't have equal strength in both arms. Right now, I'm not having a stroke. I'm able to hold both of my arms up. S is for speech, not that you had one too many. So if you went and had a cocktail and you were slurring your speech, hopefully don't do that this holiday season. But I'm talking about, for example, a husband and wife could be sitting having breakfast and all of a sudden the wife, she starts speaking like this. She's slurring her speech or very mumbled or garbled. That's S. And T is for time. Time is of the essence when you are having a stroke, okay? The faster you get there, so you'll see people had a stroke and they say no residual effects, meaning that they were lucky they had a stroke, maybe a mini stroke, and they're fine. They didn't have any paralysis, any weakness, nothing. Typically, if you have the left side of your brain and the right side. If you have a stroke on the right side of your brain and you become paralyzed, it's the left side that may be paralyzed. If you have a stroke on the left side of your brain and you become paralyzed, it's the right side, okay? So now let's see if all of that, if the options are there. Sudden weakness on one side, gradual weight gain, rash, constipation. So here's the question. Stroke symptoms include, you would have to know that FAST acronym. So now you do. Option A, sudden weakness on one side. That's the correct answer. The other options are B, gradual weight gain, C, rash, D, constipation. All right, so you would put the correct option in front of the question. Is it conclusive? Sudden weakness and on one side is a symptom of stroke. That's correct. Now you would then provide the rationale for why you're eliminating the other three options. Rash is not a symptom of a stroke, neither is constipation, neither is gradual weight gain. I think we're gonna get through the 7 disease processes. So these are going over diseases, and then we will go maybe do another skill, and then we'll do MAP as well. A resident with dementia. If you're dementia, what are you going to include? I would say they're forgetful sometimes, right? Lose ability to make new memories. So that is the option. The correct option is A. Lose ability to make new memories. B, have perfect recall. Recall is like when you remember, more short term. Never need cueing. That's incorrect. Always recognize staff. So dementia, the correct option there is letter A, lose ability to make new memories, okay? So if you put it in front of it, losing ability to make new memories describes a resident with dementia. If you eliminate, when you go to eliminate B, this is incorrect because they're forgetful, so they don't have perfect recall. C is incorrect because it says never need cueing. Cueing means when I remind you, oh, remember, go to the bed, remember on the left side. So for you to do a task, I'm cueing you, I'm kind of signaling you what's the next step because you can't remember it on your own. And then D, they don't always recognize staff. That's a big part of dementia. Okay. A resident with infection control may show. So what's the signs and symptoms of infection? Well, number one, I'm going to say fever, right? That's what I would say. If I'm using this moment to think of an answer, I don't think you have to go to CNA school. You know on your own that a fever. As a child, you got a fever. Your mom was like, oh no, you're getting sick, okay? So I would say fever. So now I'm gonna go here and see. A, low fever and confusion, a resident with infection. Now, I'm gonna show you why A is correct, but also I want to explain to you a little bit. Let me get my marker going. This vibe board, I'm always fighting with it. Okay, A is correct. Low fever and confusion are symptoms a resident with an infection may show, okay? But now, this is also a classic symptom of UTI, urinary tract infection, UTI, urinary tract infection, a classic symptom and low fever, okay? So if an elderly if they are always 98.6, 98.7, and then a day they are maybe 99.1. That's usually nothing for you to scream and write home about, right? You don't burn down the building for 99.1, but if they get suddenly confused, tell the nurse, and I'll guarantee you when the nurse sends a urine, talks to the doctor, there's a big possibility that they have a urinary tract infection. Elderly patients don't have a lot of reserve, so anything kind of tilts them off and causes them to be confused. And so that's a classic symptom of a urinary tract infection. Okay? Now let me do infection. I'll do the chain of infection cycle, and then I'll stop there. So we said A is correct, and then now we're gonna eliminate B, C, and D. B, no symptoms. That's incorrect. How would you ever know they had infection? C, higher vision. That doesn't even make sense. D, increased appetite. So the answer is A. I'm trying to see. Let's do the infection control questions. And again, because they'll ask you 4 questions infection control. I'm surprised it's not more, but 4 questions infection control. The best way to prevent infection. What's the best way? I would say hand washing. If you went to nursing school, before I see the options, use this moment to think of an answer. I'm going to say hand washing. So now the best: gloves alone, hand hygiene before and after care, wearing a gown all day, using sanitizer only. I believe that the answer is B, okay? So then you would say hand hygiene before and after care is the best way to prevent infection, period, all right? You would do your confusion to conclusion, right? Period. Gloves alone is the best way to prevent infection. I would say to you, gloves sounds amazing, but I would say, what about hand washing? Because it says gloves alone, right? Then it says wearing a gown all day is the best way. What about hand washing? D, using sanitizer only. But I just told you in some demonstrations here that a lot of things need a soap and water hand wash. C, diff, which is a contact plus, needs a soap and water hand wash, okay? A CNA should remove PPE in which order? Do you know how to take them on, how to put them on and how to take them off? PPE stands for personal protective equipment. This is your gown, your gloves, and your mask. Now, there's no technique. Either you just know it or not. So look at the questions infection control is asking you. It just wants to know how to prevent infection. It can't have new CNAs going there and spreading infection. Then it wants you to protect yourself and protect other patients. You're going to get a PPE question. So I would go look up the order, okay? So this is remove. You're making sure you're looking at, are you talking about removing or putting it on, okay? So let me get my little pen here. You remove gloves, gown, and then a mask. That's the order. When you put on, you put it on a different way. But to remove, you remove gloves, gown, and then mask. So make sure your PPE question, if it's saying put on or remove, okay? Which is an example of a fomite. And they were nice that they gave you this. But if you didn't know this term, an object carrying germs, okay? Anything in the patient's room can be a fomite. That's why you have to be careful when you put your gloves on and off so that you don't contaminate. Say if I spread germs all over this call light, because when I did the bedpan, I got stool and I got all of that on it. When the next person came and touched and got contaminated, this could be a fomite, okay? Here we go. What do we think the answer is? B, contaminated call light. All right, that's the correct answer. A TV, it's not that it can't have germs, but it's hard for people to go touching the TV or the window. And then a clean towel, in essence, is clean. So the option I would pick here is B. These two are most stationary. People could touch the remote for the TV, but the TV in itself probably won't be a huge carrier. And also, if it would, I wouldn't pick it over the call light option. All right, standard precautions apply to what? Number 31, standard precautions apply to A, only blood, B, all body fluids except sweat, C, only residents with infection, and D, disinfecting floors, okay? So the answer to that, you guessed it, is B, all body fluids except sweat. If someone's sweaty, you don't run and put gloves on, okay? All right, so that's standard. And another term for standard precautions is called universal. Why isn't it writing? Universal precautions. Guys, I think we're going to stop there. We'll pick up with mental health questions. So I'm hoping that seeing how many questions are in that category is also helpful to you. Let me stop this there. I want to do a few more skills. So what skills have we done? We've done bedpan. We've done modified bed path. We've done perineal care. Let me see what I have here. Maybe I'll do feeding and dressing as the next two, okay? And I want to do map. Let me get out of here. And I think I'm going to do 2 more demos, and then I will do map. if I could get out of this presentation, guys. Come on, this thing is so sensitive. The vibe board is really great, but it's just so sensitive when it gets itself stuck. All right, let me see if I can get this together. Okay, there we go. There we go. It let me out. I don't know. I'll try my best. If not, I will do another live because we're mental health. I want to get through all 60 of the questions. So let me see what I'm going to do here. I don't know why this is. All right, let us do feeding, okay? Let me get the feeding supplies and we are gonna go do feeding. I find that a lot of my exams, let's do feeding, range of motion. Let's bang through some quick ones here. And then we're gonna do feeding, range of motions, and maybe dressing. Those will be the next 3. Let me push this vibe board back. All right, so I hope that you are enjoying the review. Please like and share Nurse Stephanie Victoria so that I can review this with you, okay? It really helps us out a lot. Hit the subscribe button so you can know when we're doing things. Please like and share the videos. I did a live part 1 and now this is live part 2. I'm just setting up the room so that I could do feeding. I'll do feeding, range of motion, and I will do dressing, okay? I was trying to play a commercial for you, but it would not play. Okay, hold on. Okay, so I'm going to hand hygiene. All right, I'm gonna do feeding now. I'm going to hand hygiene. I'm going to gather supplies. Now, I'm gonna go in and out of the room twice. The supplies, I'm dropping this all over the place. The supplies I'm getting first are paper towels and the hand towel. I'm gonna knock, enter, close the curtain. Hi, my name is Stephanie. I am your CNA for today. How are you doing? I'm here to help you with, what is it, an early dinner, okay? So saying feeding is kind of like awkward, right? So you kind of just want to say, I'm here to help you eat breakfast, here to help you eat lunch. Can I see your ID? Okay, so now I'm going to set up my table. This is a clean surface. Okay, I'm going to put this as a clothing protector. Some people have like a big plastic thing, and if not, use a hand towel. I'm gonna put the head of bed. Now this is bold. The head of bed goes up 75 to 95 degrees. So I say just put it all the way up. All right, I'm gonna put the bedside table in front of them. Oops, my chair's here, and I'm going to now go get my stuff and I'll hand sanitize as well. So now I'm gonna go get the tray. So when I get the tray, I'm gonna have the seat. They want you to make the meal a dignified experience. So when I have a seat here, Phil, I'm wondering if we close the PowerPoint and re-put it back up. I'm wondering if we close it and re-put it back up. The PowerPoint, it hasn't loaded up on mine. If we close it and re-put it back.
I shared it to you as well.
I don't know. But
I shared it to your contact.
Okay, so what we're going to do when we come here, when we put this down, we want to ask them to verify the name again. Notice every other skill, once I did my intro and I said, can I see your ID? I didn't ask them the name again, but they actually want you to verify the name again. All right, because you have some markings on a paper here. Is this your name and date of birth? Yes, it is. Not your name and date of birth. Is this your name? Now, the reason for that is that, for example, you could be on the floor and there's 40 patients on the floor. When you go and get that tray, you can bring it to the wrong room. So this is Mary in room 201A, not Mary in 305B. So although you had originally checked the ID, when you come sit down, you want to make sure the tray is indeed in front of the correct person. And then you're going to hand sanitize, clean their hands. I'm not going to waste my Purell on a mannequin. Now I'm going to ask them what they want first, okay? So for the state exam, they're going to give you like the Jell-O pudding cups and 2 drinks. Don't forget, you have to document. So bedpan was a documentation. The state exam is a documentation as well. So on YouTube, go to my live streams, and I did a bold steps on all of the bold for all of the skills, and I reviewed documentation. So ask the patient what they would like first. What would you like first? Macaroni, please. Okay. Yum, 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 yum. Solid, check to make sure they swallowed. Would you like some drink now? Check to make sure they swallowed that. All right, and now, oops, you got a little something on your mouth. I'm gonna make small talk. I hear you have some visitors today. Who's coming to see you? My children are coming to see me. Okay, would you like another bite? So I do solid, check to make sure they swallowed liquids, and also small talk and clean their mouth. So would you like another bite? Yum, 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 yum. Did it swallow it all right? Did it go down well? Okay, would you like something to drink? All right, let me clean your mouth. Well, I'm super excited that they're coming to see you. Let's get you dressed and ready for them, and we'll bring you down to the activity room, okay? So imagine, with everything you're doing, imagine if you sit there quietly and you're just staring somebody down, right? It doesn't make sense. All right, are you all done? Yes, I'm finished. Okay, perfect. So I'm gonna clean your mouth. I'm gonna roll this away, put in the hamper. All right, I'm gonna take this away here. Don't hit your patient's legs here. I'm gonna take this away. And then I'm going to give them the call light. Call me if you need me. Their side rails up. Ask for patient comfort. Now, if they tell you to put the head of bed down, imagine you feed somebody and you go lying totally flat, right? It doesn't make sense. You have something on your paper that says do not lower it less than 45 degrees. So if they ask you, what I would do is that I would just put it down just a little bit, not less than 45 degrees. Remember, you have high Fowlers. I make sure my bed is locked, side rails up. There's your call light. Call me if you need me. This would go in the hamper. I'm going to take inventory. It looks like you ate 50% of your food and you drink 150 milliliters, okay? And if that is the case, what you're going to do is that you're going to go put this away, hand sanitize, and then you're going to document that. Don't forget the documentation is bold as well. So putting the head of bed up 90 degrees is bold, and also the documentation. Go to my bold step review video in order to watch that, okay? We're gonna take a little intermission. Theo, we're gonna take a little intermission. We're gonna take a little intermission, and then I'm gonna come back. It's 3 o'clock. I actually want to review some MAP questions. So I'm gonna switch gears from CNA to MAP. I don't know if we'll get all 60 questions, but I promise you I'll finish it and it's live in a part 3. So we're gonna do an intermission. We're gonna come back to part 3, and I'm gonna do our MAP.